Okay, that's embarrassing. Sorry,
funny.
guys.
No, that makes sense.
Okay, I'm gonna start now.
Okay.
All right. So, hello. My name is. There we go. My name is Mary Burke. I am your student speech language pathologist. So your student has been diagnosed with childhood apraxia of speech. According to ASHA, which is the American Speech and Hearing Association, childhood apraxia of speech is described as a neurological childhood speech sound disorder in which the precision and consistency of movements underlying speech are impaired in the absence of neuromuscular deficits. So this kind of like impairs the child's ability to like plan out their motor movements, so like lips, tongue, and jaw. This will result in abnormal reflexes and abnormal tone. So this is just a quick video of your kindergarten student in a session. Let me know.
We're gonna go. I'm gonna say it first, and then we're gonna say it together. Mad cat, I-E, TikTok. Fight. Did you hear it? Oh no, he fell.
I lose us.
We don't want him to lose, do we?
Why?
Okay, here we go. Ready? Fight. Yeah, it's the word eat. Eat. Fight. You do it. Eat. Yes, fight. I like.
So like during this session, we were just kind of like trying to get an idea of like the severity of the apraxia, how it's going to impact them in a school setting, or like during play or social interactions. But
that helps you with that vowel.
Kind of like a groping sensation of how his mouth is like trying to find the right placement for the certain sounds he's trying to.
Oh, you said fought.
Fad.
No, not a drum. Not is loud. Duh. Feel it on my neck. I want you to feel it right here. Duh. You can feel it on yours. Ready? Da da da. Do you feel?
So you kind of get an idea of that. So then we will go into, or what we're going to cover today. We're going to go over the characteristics of childhood apraxia of speech, or CAS. I'll refer to it as CAS. What the assessment process looks like for your student, the treatment plan, and roles and responsibilities of you as their teacher. So this is a little video on CAS. We're going to watch just a brief amount of it.
Tashi Duncan, she's gonna turn a whole family into millionaires.
Critics are calling challengers sexy, electrifying, and delirious.
Which a person has the language capacity to talk, but the signals between their brain and mouth muscles aren't sent correctly. This can create a lot of frustration. A seemingly simple task that most of us do every day, speaking clearly, can be very challenging for people with apraxia. Apraxia can be something a person is born with, called childhood apraxia of speech, or CAS for short. Apraxia can also happen later in life after an event like a stroke, traumatic brain injury, tumor, or progressive disease. This is called acquired apraxia of speech. Childhood apraxia of speech is estimated to occur in about 1 in 1,000 children. But there isn't much reliable information about the prevalence of acquired apraxia. This is because it can be difficult to distinguish apraxia among other motor difficulties in people who have several diagnoses. Symptoms of apraxia is a vital skill for everyone. Not only does it enable us to convey our thoughts and needs, but it's how we connect and form relationships with others. Fortunately, effective speech therapy treatment is available for apraxia. However, a speech therapist isn't always able to predict how much progress a person will make. As the symptoms of apraxia can differ from person to person, so do each person's treatment goals, progress, and results. To get a better understanding of apraxia, let's take a look at some of its main characteristics. One symptom is inconsistent errors in speech. A person with apraxia may pronounce the same word differently each time they say it. For example, one day they may say a difficult word correctly, but soon after they may have trouble repeating it. People with apraxia may distort their sounds. Because their mouth muscles aren't moving in the right way, sounds often come out incorrectly. Pronouncing vowels can be especially difficult, as well as longer and more complex words. Another characteristic of apraxia is groping for sounds. When trying to say words, people can appear like they're groping and making odd movements with their mouth. They may try saying a word several times before they say it correctly. People with apraxia may struggle with the intonation and rhythm of speech. They may speak in a monotone, omit syllables in words and phrases, or pause inappropriately while speaking. Apraxia may also cause difficulty with volitional movements. A person with apraxia may have a tough time initiating what they want to say, such as asking a question or making a comment. Automatic speech may be easier, such as counting or saying the alphabet. For example, if a person with apraxia is asked, "What's your name?" they may be able to reply easily, since this is a question they've been answering their whole life. But if you ask them to repeat their name after you, that might be more challenging. Finally, people with apraxia may have an easier time moving their mouth for non-speech tasks. For example, someone with apraxia may be able to touch their tongue to their top lip. However, the tongue elevation needed in certain speech sounds may be difficult. So before we wrap up, let's go over the key points we've covered here.
Okay. So kind of just reiterating what she was talking about in the video, kind of that your student has a generally good understanding of language. Like for example, he knows what he wants to say and has typical receptive language skills. For him, CAS can be frustrating, especially for like all children, because they're just not being understood. It's such a vital time in their lives while learning language and communication. So they kind of look like they are moving their mouths to say something, but they're struggling to say it in the correct way. So again, kind of that groping pattern. So the assessment process for CAS starts with a screening for the disorder. A screening is conducted whenever a speech sound disorder is suspected. The purpose is to identify those who require further speech and language assessment or referral for other professional services. As of right now, for CAS, there are no available screening tools. This is because we get most of the results from observations made over treatment. But it's still important to do a screening process to look for other disorders that may be co-occurring at the same time. We will then conduct a comprehensive assessment for your student. So this is kind of like after they're referred to the SLP, we want to identify underlying strengths and weaknesses in speech sound productions, comorbid deficits, like other developmental disabilities. We want to see limitations in activity and participations, like interactions with family or peers, like on the playground during recess. Contextual factors, whether any environmental or personal factors are affecting their speech, and if they serve as barriers of successful communication. Within a comprehensive assessment, we will perform a dynamic assessment. So this is kind of important for differential diagnosis of CAS and for determining severity and prognosis. This can kind of help the clinician better judge the child's speech production. It's kind of like getting background info, maybe family interviews, just kind of getting to know the child. With assessing any student, we want to make sure we're taking cultural and linguistic considerations into account. This can be a huge part of the assessment process, and without diving deep into these factors of the student, we can misdiagnose the student. Because CAS will influence production across all languages, in the case of if they're bilingual. So errors might be manifested differently in each language. We want to make sure we are aware of any of these differences. I know I'm kind of throwing a lot of information at you guys. Do you have any questions?
I just got a quick question, just out of curiosity, and it's okay if you don't know this.
Yeah.
But does CAS come as a spectrum? Like,
I don't know if it's like necessarily a spectrum. I think it just like depends on the severity of it.
okay. And then, sorry. And then just out of curiosity, as an elementary teacher, how soon are we able to like tell that a child is like struggling with this or has this?
Yeah, so when it's childhood apraxia of speech, there will be some signs, like if they're a late talker, you're usually supposed to be hitting a certain amount of words at 1 year. If they're not like reaching those goals, or if they're even like starting school, and they only have a few words, that can be a sign. Also then again, just like those characteristics, like the groping or low intelligibility, stuff like that.
Okay, thanks. That was just out of curiosity.
Yeah, no, of course.
If I could piggyback off of that question, so what kind of treatment is there? Is it like a medicinal or like what kind of treatment is there?
Yeah, so for that, it's gonna be just consistent speech therapy. In a few slides, I have like a whole bunch of techniques that, depending on the student, might work. So I will get to those. I think it's like the next slide after this one. Okay, so after conducting the assessment, we will then get our results. So that will give us the diagnosis of CAS or other speech sound disorders, whether it's articulation disorder or phonological disorder. We will get to see kind of the severity of the disorder for that student, factors that contribute or may have contributed, whether it's environmental or personal. We will find what AAC device will work best for this student and if that's the best way to go. Recommendations for multi-tiered system of support in school. So that's kind of where you guys will come in. An example of a multi-tiered system is response to intervention. Have you either of you ever heard of that? Okay, so response to intervention, it's kind of just like ensuring that the student is in like the right environment to receive care that's going to be the most successful for them. So like struggling learners are provided with interventions at increasing level of intensity to accelerate their rate of learning. They can be provided in a variety of personnel, like maybe a special ed teacher, general ed teacher, a speech language pathologist. So yeah, kind of just ensuring that they're in a comfortable environment.
Sorry to interrupt you again.
Yeah.
But is that like when they get their IEP and like 504 plan? Is that when they get all that?
Yeah, kind of. It'll be
Okay.
stuff discussed in the IEP plan.
Okay.
And then also from the results, we'll get to see if we want to refer the student to any other professionals as needed. All right, so with our assessment results, we can come up with a treatment plan. These are just a few options. It kind of varies for every student or a child that has CAS. So there are a few different approaches. So the motor speech disorders require repetitive planning, programming, and production practice. Therefore, intensive and individualized treatment of childhood apraxia is often necessary. So we kind of want to focus on increasing speech production and intelligibility. Kind of going back to like the response to intervention. We want to make sure that treatment takes place in a naturalistic environment and is provided in a culturally appropriate manner. We want to involve as many important people in the child's life as possible to facilitate carryover and generalization of skills. So again, this would be called a push-in service. So instead of like pulling the student out of the classroom to take them to a therapy setting alone, we'll kind of do the best we can to treat them, maybe when they're around their peers on recess or just take some data. So a motor programming approach that is beneficial for CAS is the DTTC, which stands for Dynamic Temporal Tactile Cueing. It's an integral stimulation kind of look, listen, do what I do method. It uses a cueing hierarchy. So like we can start with auditory and go to visual and then use tactile. So like touch and feeling, like having like in the video when she was like, feel right here. So with that, we systematically decrease supports as the child achieves success at each level of the cueing hierarchy. That is probably the most popular approach for treating students with CAS. The next one is rapid syllable transition, or REST. It's a method that involves repetition of varied sequences of real or nonsense syllables to train motor planning flexibility for maybe when they're using it in a conversational setting. There are linguistic approaches, which focus on CAS as a language learning disorder. These approaches teach children how to make speech sounds and rules for when speech sounds and sound sequences are used in language. So the cycles approach targets phonological pattern errors. It is designed for children whose speech is highly unintelligible and who have extensive omissions, which is when they're just like fully cutting sounds out. Some substitutions and restricted use of consonants. And then the IPA is the integrated phonological awareness. It's designed to simultaneously facilitate phonological awareness, letter to sound knowledge, and speech production in preschool and young age children with speech and language impairments. So that would be for your student, as he is a 5-year-old, a kindergartner. And then the rhythmic approach is probably the least used. It uses intonation patterns like melody, rhythm, and stress to improve functional speech production. So MIT melodic, I say that wrong, intonation therapy is a prosthetic facilitation approach that uses singing and rhythmic speech and like hand tapping to train functional phrases and sentences. And then lastly, AAC devices have been really beneficial for students with childhood apraxia of speech. It stands for augmentative and alternative communication. And I will get more into that in the next slide. Do either of you have any questions on treatment plans? Okay. Okay, so AAC devices, the most important thing that we find an AAC device that, or if like the AAC device is the method of learning that will work best for this child. So there are a few kinds of AAC devices. I will get into the one that's most beneficial for AAC, but just to get a little background on AAC devices. So there's unaided and aided. So unaided doesn't require any external equipment. So this could be like gestures, signs, facial expressions, body language, stuff like that. Aided AAC is gonna use equipment. It comes in low tech or high tech. So low tech is kind of like a picture book, like you see down here. They can flip that. And then how it works is they basically just point to what they're trying to say. And then high tech could be like iPads, applications, or like specific AAC like devices that are like speech generating. Here is a video of not your student, but a child with apraxia using a speech generating device.
So can you introduce yourself to our friends?
Come on.
How are you?
I'm fine. How are you?
What's your name?
My name's John. What's your name?
My name is Emily.
Good boy.
Nice to meet you.
Okay, just like a short example. So that will be the kind of AAC device that I feel would be best for your student. Just as it's speech generating, it's easy to use and promotes language learning. Any questions? Okay. Okay, so getting kind of after we know the student has CAS, what you guys should expect in a school setting. So we want to look at IDEA. Have either of you heard of IDEA? Okay, well, just I'll tell you guys what it is. So it's the Individuals with Disabilities Education Improvement Act. So it's basically the criteria for determining eligibility for services in a school setting. So some questions we want to ask ourselves are, is there a disability? If so, is there an adverse effect on educational performances resulting from the disability? And if yes, again, are specially designed instruction and or related services and supports needed to help the student make progress in the general education curriculum? So in your case with your student, yes. So if we answer all these as yes, then we can go ahead and start treating them in the school setting for the disorder. So kind of like the goal of this is for like the public school or school speech language pathologist to remediate or improve a student's communication disorder such that it does not interfere or deter academic achievement and functional performance. So again, kind of that we want to keep them in the general education setting as much as possible. So do either of you have any ideas of how you can help support your student in the classroom?
I know just being a student myself, with a learning disability, I struggled being comfortable using my accommodations. So I think just providing that environment of like, hey, like if you need extra help or if you need to use like, I don't really like the word accommodations. I like to use more tools, like just use the tools that you need to help you be successful. Because I know how many times kids or students can be feeling singled out or even more quote unquote special because they have to use an extra hand or an extra tool to get to the point where their other peers are at.
Yeah.
So just creating that environment of like you're not different. You just need a little help.
Of course.
I
Of
one
course.
hundred percent agree with that. Sorry to cut you off. Um, I have ADHD and dyslexia, kind of the same deal, in regards to like just feeling isolated in a classroom. Um, because there's like a lot of times where even still into college, like everyone around me is understanding it and I feel like I'm the only one who doesn't. So, um, kind of just like encouraging that student, um, to like to be like, hey, you got this, and just give them that extra word of affirmation and like that they and it's just to boost their confidence a little bit. Because I know that I would never ever raise my hand because I was afraid to be wrong, but just like challenging them a little bit and being like, yeah, you got this.
Yeah. Yeah, no, of course. Thank you guys for sharing. And just stuff like that is also so important at that age, just as they're developing and learning new things. We want to make sure we're supporting them in anything that they need. Thank you guys. Okay, so just kind of going into some roles and responsibility as you guys as educators. So kind of what both of you talked about, just kind of like supporting the student. Also making sure we're like providing alternatives to speech if it's necessary. We want to make sure that the student can successfully complete assignments, tests, and activities, but we also want to make sure they're supported. One thing or one way you guys could do this is to like ask the student to repeat their statement or question when appropriate, ensuring that it's in a private setting, not to single them out. Let the student know that what they have to say is important to you. And again, just not putting them on the spot in front of their peers. So as me as an SLP, I'll work with you collaboratively. Again, just making recommendations for the multi-tiered system of approach. So again, the response to intervention to support speech and language development for the student in the best way possible that works for them. Then kind of what Sophia said, like discussing with the IEP team is really important. The IEP team is individualized education program. It consists of parents, general education, educators, special educators, administration, SLP. We kind of want to talk about the eligibility for services based on the presence of CAS and any co-occurring conditions, and just continuing to talk about progress made that maybe you guys see in the classroom that I don't see, to ensure that we are treating the students to the best of our abilities. And then also just allowing them to use their AAC devices and encouraging them to use it. AAC devices will never take away from language and communication development. So just like if you think it's being distracting, don't take it away from them. There's other ways to work around that and use it in the appropriate ways. So yeah. Any questions? Okay, well, that is all I have for you guys today.
Thank you.
Thank you.